I'm Dr. Gowher. I'm a chiropractor here at North York Med Rehab. The way I practice is we want to make sure that we're providing the most effective care in the shortest amount of time. So generally a patient's experience when they come to the clinic is we'll have them sit down here and then we'll ask them a detailed history. Pretty much what I want to know is what is your pain, how it started, what is making it worse, what is making it better. And getting a better understanding of the pain can help me better understand what I can do to provide you the best level of care here. So generally patients will come in, they will have a seat here, and we will have a nice interactive conversation. After that, we get into a physical exam. And the purpose of this exam is really to find out where your pain is coming from, and then hence that will render our diagnosis, which we will treat. A patient's experience when they come in here, we'll do a lot of work on their muscles typically to reduce some of that muscle tension. We can do some spinal adjustments or some mobilizations to joints that feel a little bit restricted or not moving as much as they should be. Then we really incorporate all of that around active care. At the end of the day, we want people to leave here feeling not only better, but stronger than they ever felt. So we really incorporate a lot of exercise, strength training. We give them education tips on what they can do at home to prevent flaring their pain. And then we really take care of them from the beginning to the end. Patients have to feel welcome. They can obviously ask questions anytime they have. And it's a more personal touch to the care we provide here. So we have Isha in here. So if she comes in with some neck pain, we'll do a full assessment of her head, neck, range of motion. We'll test the nerve, we'll test the disc. Assuming it is something within the chiropractic scope of practice to treat, we can work on these muscles here. We can work on these joints here, and then we can back it up with some active care. A lot of the therapy here is going to be very specific, very targeted. We won't waste our time doing things that we don't need to do. So for example, if she's got some pain in her upper trap here on the left side, we can do some myofascial releases. And really the purpose of this therapy here is to kind of get into those muscle fibers that we feel the knots or the restrictions in that tissue, and kind of work that muscle so that it's moving a lot better. And by moving a lot better, it should take off pain. We can do some adjustments here. And then after that, we'll do a full assessment on how she's moving her neck, how she's moving from when she's walking, bending, twisting. We'll address any issues there so that we can give her a nice prescribed exercise plan and give her the most up-to-date treatment for her. Have a good one.